Did you know that there could be something serious happening inside your brain right now, and you might not feel a thing? It's scary to think about, but it's true. Every year, thousands of seniors across the US suffer from brain aneurysms without any warning signs until it's almost too late. Many of them were just like you, going about their day, assuming a headache was just a headache, or blurry vision was just age catching up with them. But the truth is, there are early signs that something dangerous might be building inside your brain. And the problem is, most people don't recognize these signs for what they really are. That's why today's information could be life-saving, for you or for someone you love. I'm going to walk you through 7 warning signs of a brain aneurysm that many seniors miss. These signs can show up days or even weeks before a rupture. If you know what to watch for, you could get the help you need in time. You don't need to panic, but you do need to pay attention. This isn't about fear, it's about being prepared and protecting yourself. Before we dive in, I'd love to know, where are you watching from today? Drop your city or state in the comments below. I always love seeing how far our community is reaching. Sign 1, sudden, severe headache. If there's one sign you should never ignore, especially after 60, it's a headache that comes out of nowhere and feels worse than anything you've experienced before. This isn't your usual tension headache or even a migraine. This is a sudden, intense, explosive pain that some people describe as feeling like they were hit in the head with a hammer or struck by lightning. Doctors often call this a thunderclap headache, and for good reason. It's the kind of pain that stops you in your tracks. Now here's why it matters. According to the Mayo Clinic and Johns Hopkins, a headache like this can be the first sign that a brain aneurysm has started to leak. It doesn't mean it's burst yet, but it means you may only have days, sometimes even hours, before it does. That's your warning window, and recognizing it can be the difference between life and death. Let me share a true story. Margaret, a 67-year-old grandmother from Ohio, had what she called the worst headache of her life. But she brushed it off, took her usual pain relievers, and assumed it was just stress or dehydration. For 3 days, she tried to push through it. But by the time her daughter insisted on taking her to the emergency room, the aneurysm had already ruptured. She survived, but the recovery was long and incredibly difficult, months of rehab just to walk steadily again. The problem is, many of us have been taught to tough it out. Especially as we get older, we're used to little aches and pains. But this kind of headache is different. It builds fast, feels unlike any headache you've had before, and often hits its peak intensity within minutes, not hours. You can't wait and see with this one. That delay can cost you everything. If this happens to you or someone you love, don't try to sleep it off or treat it at home. Call 911 immediately. When you get to the emergency room, be specific. Say, "I'm having the worst headache of my life, and it came on suddenly." That helps doctors take the right steps quickly. They may do a brain scan to check for any bleeding or swelling, and if they catch it early, treatment can begin before the aneurysm ruptures. Sign 2, sudden vision changes. Have you ever had a moment where your vision suddenly went blurry, or you saw double for no clear reason? Or maybe you noticed one of your eyelids starting to droop out of the blue. It might have seemed like just tired eyes or the need for new glasses. But for those of us over 60, these changes could mean something far more serious, a warning that a brain aneurysm is pressing on a nerve or beginning to leak. Aneurysms, especially those near the front of the brain, can put pressure on the optic nerve or other parts of the brain that control eyesight. According to doctors at Johns Hopkins and the Brain Aneurysm Foundation, when this happens, your vision may change suddenly, and these changes are often only in one eye. That's one of the key signs it's not just aging. It's a sudden, one-sided change that doesn't improve with rest or reading glasses. Let's talk about Carol, a 65-year-old retired schoolteacher from Arizona. One morning while reading her newspaper, she noticed that the words were doubling up. She figured she just needed a stronger prescription and put it off. 3 days later, while driving, her vision blurred again, and this time, she couldn't react in time. She ran her car off the road. In the ER, scans revealed that a brain aneurysm had ruptured. Carol survived, but her recovery was painful and long, and she wishes she'd taken those early signs seriously. This is why it's so important to listen to what your body, and in this case, your eyes, are trying to tell you. If you notice any of the following, don't wait. Sudden blurry vision. Seeing double. A drooping eyelid, especially on one side. Trouble seeing to the side, loss of peripheral vision. Even if the symptoms come and go, they still need to be taken seriously. These aren't normal signs of aging, and they're not something you should watch for a few days. In fact, the American Stroke Association warns that many seniors dismiss these signs because they seem minor, but doing so could mean missing your chance for early treatment. If this happens to you, ask your doctor to look deeper, don't settle for an eye exam alone. Request a neurological evaluation or brain scan to make sure nothing more serious is going on. Be specific about when the changes started and if they came with other symptoms like headache or nausea. Sign 3. Pain above or behind one eye. Have you ever felt a deep, uncomfortable pain right above or behind one of your eyes, something sharp, focused, and different from your usual headaches? If you're over 60, this kind of pain could be more than just eye strain or sinus trouble. It might be your brain warning you about something serious, like an aneurysm developing or beginning to leak. Most people don't realize that aneurysms often form near the base of the skull, close to the nerves that connect to the eyes. When an aneurysm presses on these nerves, it can create pain that feels like it's coming from behind the eye. Doctors at the Cleveland Clinic explain that this pain isn't widespread, it's usually very localized. And unlike sinus pressure or typical headaches, it doesn't come and go easily, or fade with rest or over-the-counter medicine. It can feel sharper, more intense, and more stubborn. Let's take the story of William, a 72-year-old retired accountant. He began experiencing a stabbing sensation behind his right eye in the middle of allergy season. Like many, he assumed it was sinus-related and blamed it on the weather. But as the pain got worse and lasted more than a week, his daughter became concerned and took him to the ER. A brain scan showed a 7 mm aneurysm pressing against the nerves near his eye, and it had already started leaking. Because they caught it just in time, William was treated before it could rupture. This kind of story happens more often than people think, especially among older adults. Many of us are used to writing off pain as just another thing or part of getting older. But in this case, dismissing pain above or behind the eye can be dangerous. Aneurysms in this area are notorious for causing focused, unexplained discomfort. Here's what to watch for. Pain that's located directly above or behind one eye. A sharp, persistent sensation that doesn't match your usual headaches. Pain that doesn't respond to usual treatments like eye drops, sinus meds, or pain relievers. If you experience any of these, especially with other symptoms like vision changes or a headache, it's important to speak up and ask your doctor for brain imaging. Don't settle for a guess or a quick prescription. Tell them exactly where the pain is and how it feels. Use phrases like sharp, stabbing, or deep pressure behind my eye. It helps them understand the urgency. The Brain Aneurysm Foundation warns that too many older adults delay care because this kind of pain mimics more common issues. But if an aneurysm is caught before it ruptures, treatment can be straightforward and highly effective. Sign 4. Unusual sensitivity to light. Has regular daylight suddenly started feeling too harsh or painful to your eyes? Are you finding yourself wearing sunglasses indoors, or squinting in rooms that never bothered you before? If so, this might not be just aging eyes or a passing sensitivity. For seniors over 60, sudden light sensitivity, known medically as photophobia, can be an early warning sign that something serious is going on in the brain, including the early stages of a leaking aneurysm. Now let's be clear, light sensitivity can happen for many reasons, like cataracts or eye strain. But when it shows up suddenly, with no clear cause, and especially when it's accompanied by a headache or pain behind the eyes, it's time to pay attention. According to neurologists at the Cleveland Clinic and researchers at the University of California, San Francisco, this kind of photophobia often appears when blood from a leaking aneurysm irritates the meninges, the protective layers around your brain. When those layers are disturbed, they trigger the same nerve pathways involved in migraine headaches, which is why light suddenly feels unbearable. Let's look at Susan's story. She's a 68-year-old grandmother who began noticing she needed her sunglasses, even at her granddaughter's birthday party inside the house. At first, her family joked about it. But when she also mentioned feeling a dull headache and some nausea, her daughter insisted she go to the hospital. That decision likely saved her life. A brain scan revealed a leaking aneurysm. Because they caught it early, doctors were able to treat it before a full rupture. That's the kind of action that makes all the difference. Here are the signs that your light sensitivity may be more than just aging. It appears suddenly and without explanation. It's worsened by sunlight or indoor lighting that never used to bother you. It's accompanied by other symptoms like headache, eye pain, nausea, or stiffness in the neck. It doesn't improve with rest, eye drops, or dimming the lights. If this happens, don't just brush it off or adapt by avoiding light. Instead, speak with your doctor right away. Be specific. Explain that this light sensitivity came on quickly and feels unlike your usual visual discomfort. Ask directly whether this could be neurological in nature, not just an eye issue. Doctors can perform simple evaluations and, if needed, order imaging to check for pressure or bleeding around the brain. Sign 5, unexplained nausea or vomiting. Have you ever felt suddenly nauseous or even started vomiting, and you couldn't figure out why? Maybe you hadn't eaten anything bad, you weren't sick with a cold, and there were no signs of food poisoning, but the queasiness just wouldn't go away. For older adults, especially those over 60, this kind of unexplained nausea might not be coming from your stomach at all. It could be coming from your brain. Most of us naturally assume that nausea means something is wrong with what we ate or how our stomach is acting. But according to neurologists at Stanford Medical Center and the American Stroke Association, a brain aneurysm, especially one that is beginning to leak, can cause nausea or vomiting without any connection to digestion. This happens because the leaking blood increases pressure inside the skull and irritates the brain's protective lining, including an area known as the vomiting center. When this area is affected, your body reacts as if something's wrong in your stomach, even when the real issue is higher up. Let me share James's story. He's a 71-year-old retired postal worker who started feeling nauseous a few days after beginning a new blood pressure medication. He assumed that the pills were making him sick. His appetite disappeared, and he spent most of the day lying down. But the nausea didn't go away, and on the third day, he developed a splitting headache. His wife called for an ambulance. A CT scan at the hospital revealed that James had a leaking brain aneurysm. Thankfully, they caught it in time, and he was treated before a full rupture occurred. This is a common scenario. Seniors are often on multiple medications, and it's easy to blame symptoms like nausea on side effects, stress, or a sensitive stomach. But here's how to tell the difference. The nausea comes on suddenly, without a known cause. It doesn't go away with antacids, rest, or typical remedies. It may worsen when you move, bend over, or lie down. It often comes with headache, vision issues, or light sensitivity. If you're experiencing nausea like this, don't just wait it out or assume it's something minor. Take note of any other symptoms that appear with it and share everything with your doctor. Be clear. This nausea came on out of nowhere, hasn't improved, and I'm worried it may be neurological. That phrasing helps doctors consider conditions like aneurysm or increased intracranial pressure and order the right tests. In the emergency room, make sure they know you're concerned about your brain, not just your stomach. The combination of headache, nausea, and light sensitivity is well known among doctors as a red flag, and responding quickly can prevent a much more serious outcome. Sign 6, stiff neck or neck pain. Most of us over 60 have woken up with a stiff neck at some point. Maybe we slept in the wrong position or sat too long in one spot. so it's easy to shrug it off as something harmless. But what if that neck pain comes on suddenly, feels different from usual, and won't go away, even with rest, heat, or over-the-counter medicine? In older adults, a stiff neck can sometimes be a critical warning sign of a leaking or rupturing brain aneurysm. It might sound surprising, but neurologists at Harvard Medical School and the National Institute of Neurological Disorders and Stroke explain that blood leaking into the brain's protective layers can cause inflammation that leads to intense stiffness or pain in the neck. This happens when the meninges, the protective covering of your brain and spinal cord, become irritated. And this is not your typical muscle strain. Let's take the case of Margaret, a 74-year-old with arthritis. She felt her neck become stiff over the course of a day. It was hard to turn her head, and when she tried to touch her chin to her chest, the pain was sharp and limiting. But since she had chronic arthritis, she assumed it was just one of those flare-ups. 2 days later, while making breakfast, she collapsed. The aneurysm had ruptured, and by the time help arrived, she was unconscious. That's how fast things can go wrong when warning signs are missed. Here's how to tell if your stiff neck might be more than just normal discomfort. It appears suddenly, without any injury or strain. It makes it painful or impossible to touch your chin to your chest. It's accompanied by a headache, light sensitivity, nausea, or confusion. It doesn't improve with massage, heat, or pain medications. If any of this sounds familiar, don't wait and hope it gets better. Call your doctor, or better yet, go straight to the emergency room. When you arrive, be direct, say that your neck stiffness is sudden, unusual, and that you're concerned it may be neurological. Ask them to assess you for any signs of a brain aneurysm, especially if it's paired with other symptoms mentioned earlier in this video. Doctors can perform simple bedside tests and order scans if needed. This is one of those symptoms that seems mild at first but can signal something truly serious. And the sooner they catch a leaking aneurysm, the better your chances of avoiding a rupture, and everything that follows. Sign 7. Confusion or difficulty speaking. Have you ever had a moment where you couldn't find the right words, or felt confused about something that's usually second nature, like where you put your keys, what day it is, or how to finish a sentence? It's tempting to chalk this up to just getting older. But when confusion or speech trouble comes on suddenly or feels noticeably worse than usual, it could be your brain signaling a medical emergency, possibly a leaking brain aneurysm. Researchers at the National Institute of Neurological Disorders and Stroke explain that even small amounts of bleeding or pressure from an expanding aneurysm can interfere with the brain's ability to process thoughts or control language. The areas responsible for clear thinking and speech are extremely sensitive. When they're irritated or compressed, it can cause noticeable changes in how you speak, understand, or remember simple things. And here's the challenge, because these symptoms don't always cause pain, they're often overlooked. Family members may assume it's just aging or a senior moment, especially if it passes quickly. But that misunderstanding can cost you precious time when early treatment could prevent a full rupture. Let's talk about Daniel. He was 70 years old, still sharp as ever, and had a routine phone call with his daughter every Sunday. One day, during their chat, he couldn't seem to find the words for simple things. He called her Mary instead of her real name, paused awkwardly mid-sentence, and then laughed it off, saying, "I must be tired today." His daughter was concerned, but unsure if it meant anything. 3 days later, Daniel suffered a brain aneurysm rupture. Looking back, his daughter realized that phone call had been the warning. Here's how you can spot the red flags. Sudden confusion or trouble remembering simple things. Difficulty speaking or finding the right words. Using words incorrectly or mixing up names and details. Feeling foggy or unable to focus, even in familiar situations. These changes aren't always dramatic, but they feel off. If they come on quickly, or feel different than your normal memory slips, don't wait. Especially if they're paired with headache, nausea, or vision changes, it's important to act fast. Write down what happened, when it started, and what else was going on at the time. Bring that information with you to the doctor or ER. And when you speak to a medical professional, say something like, "I had sudden trouble speaking clearly and remembering things, and I'm worried it could be neurological." That specific description helps doctors know that they need to check for things like aneurysms or stroke, not just memory loss from aging. Sudden confusion or language trouble is one of your brain's final warning signs before something more serious happens. If caught in time, treatment can be life-saving. But once a rupture occurs, the damage is often permanent, or fatal. Now that you know the 7 warning signs, take a deep breath, because this knowledge puts you ahead of the curve. Too many people never see it coming. They assume the headache is just stress, the vision changes are just aging, the nausea is just something they ate. But now, you understand that your body sometimes whispers before it screams. And those whispers, those subtle symptoms, could be your brain's way of saying, "Help me before it's too late." So if you've experienced even one of these signs recently, or if someone close to you has, don't hesitate. Write it down. Make the call. Go to the ER if needed. Be clear, be firm, and don't worry about being dramatic, you're being smart. You're protecting your life and your independence. Before we end, I want to invite you to do one small thing that could have a big impact: share this video. Someone you care about, maybe a friend, a neighbor, a family member, might be experiencing one of these signs right now and not even realize what it means. Sharing this could save their life. And if any of these symptoms surprised you or reminded you of something you felt before, please leave a comment below. You're not alone. Let's start a conversation and help others recognize the signs early too. And don't forget to subscribe for more senior-focused health information, because staying informed is one of the best ways to stay strong, stay safe, and stay independent. You've got the knowledge now. Let it work for you, and for the people you love.